Aloha, malolele, and talofa. Welcome back to the Aloha EQ or Emotional Intelligence podcast, the place where emotional intelligence meets island wisdom. I'm your host, Ruth Kongaika. I was born in a small hospital in Mount Pleasant, Utah, a tiny baby, just 5 pounds. From the beginning, I was surrounded by what we think of as modern medicine: doctors, procedures, structure. When I was 4, I had my tonsils removed. At 16, I was treated for heavy bleeding. That same year, I dislocated my kneecap doing the splits, and I still remember going to the doctor to have it put back in place. Over the years, that knee has continued to give me trouble, swelling, pain. I've had access to treatments like injections every 6 months. I saw how carefully everything was recorded, tested, analyzed. There was a sense of precision, a sense of, we will find out what is wrong. I was a medical secretary. I typed pathology reports, learned medical terminology, and worked closely with the doctors. Then life took me somewhere very different, to Tonga, a place of beauty, of ofa, of deep family connections, but also a very different healthcare system. In Tonga, care was available to everyone. Resources were limited. I remember sitting on a cement bench for hours, holding a crying baby, waiting to be seen. And when you were finally seen, the treatment was often simple: Panadol, antibiotics, whatever was available at the time. Sometimes medications came from overseas and weren't always current. And you learned quickly this system depended on what they had, not always what you needed. I had one of my babies in Tonga, and I will never forget it. There were no rooms available. So I gave birth in the foyer. People were walking by, watching, family members of others standing nearby. In island culture, birth is not always private. It is communal. But for me, it was overwhelming. My labor was long, just like my first. But this time, it was in front of an audience. After the baby was born, there was no nursery. No one came to take the baby so I could rest. You bring your everything: cloth diapers, food, support, if you have it. And at that time, I didn't. So I washed diapers in the sink by hand, hung them up to dry, cared for my newborn. And I remember going home with a fever of 104. Eventually, an auntie came to help, and that's something I want to honor. In Tonga, there is always family. Even if it takes time, someone comes. That is something very special. In the hospital, they would wake you up at 5 a.m. to bathe your baby. You were given 1 meal a day, mostly cold canned spaghetti. Then there was no laundry service, no cafeteria, no extra care. And yet, people endured. They supported each other. They made it work. When I returned to Utah and had another baby there, it felt like a completely different world. Meals brought to me 3 times a day, a nursery where someone could care for my baby so I could sleep, medication for pain, 5 days to recover. And I remember thinking, I didn't know how much I needed this until now. Later in American Samoa, I had another child, and that experience was difficult. There was an expectation to be silent during labor. I remember hearing other women being corrected harshly, and I became very quiet. After the birth, we were all placed together in a ward, and there was something beautiful in that. We learned to breastfeed together. I ended up nursing my baby for a full year, something I had not done before. But there were also challenges. My baby developed impetigo, a skin infection from an unsterile environment. So again, there was both good and difficult. One of the most meaningful lessons I learned was about traditional healing. In Tonga, many families have knowledge passed down through generations, herbs, roots, coconut, noni. My babies once had severe thrush. Nothing from the hospital helped. Their grandmother took them, prepared a traditional remedy, and within hours they were better. That moment stayed with me because it showed me healing is not only found in modern medicine. I also saw things that were hard to understand. My father-in-law accidentally cut off his thumb. At the hospital, it was not reattached properly. It healed, but in a different way, and became part of his identity, a nickname, a story. His children were known forever as Pekanene, which means pistol. Another time, my son had boils under his arms. The doctor treated them with what was available and even used feminine napkins as bandages. And you know what? We adapted because that's what people do. After returning to the mainland, I struggled. PTSD, anxiety, depression, and I was prescribed medication that I stayed in for many years. So even in the modern system, there are struggles. There are unintended consequences. I've often experienced complications from surgery, possible infections, moments where I didn't feel heard by doctors. So I can't say one system is perfect. I've seen flaws in both, but I have also seen incredible care. Doctors who take time, systems that test, diagnose, and treat. In places like New Zealand, I saw nurses who visited homes, checking on mothers and babies. That felt like a beautiful balance. What stayed with me the most was not the medicine. It was the feeling. In some places, I felt supported, but under-resourced. In others, I felt resourced, but sometimes alone. So when we talk about healthcare, it's not just about cost. It's not just about access. It's about how do we care for each other? Because real healing is not just physical. It's emotional, it's cultural, it's human, it's aloha, it's ofa, it's alofa. Maybe the answer isn't choosing one system over the other. Maybe it's learning from both.